Okay, so hello there. Good morning, good afternoon, or good evening, depending where you are. I'm Anna, and we're going to work together today with OET Speaking. I hope you're all ready for a very busy class. We have lots to cover today. You can send in your questions, your comments throughout the class. So let's get started. The first thing we're going to look into, oh, yes, today, Black Friday. I'm sure that you guys are like full of plans for your Black Friday in many areas. And you can also think of your Black Friday here at E2 with us. So check out with the code Friday22. Now, when it comes to the role play card and preparation, um, you really have to put in some time. They give you the 3 minutes, and it's really worthwhile to use the 3 minutes wisely. The best tip that I can think of right now before we move on is to learn how to take notes, because note taking get your notes afterwards, but while you're preparing, it'll help organize what you're going to say to the patient. So note taking can be helpful. After you have read the setting, there are other elements for you to consider to guarantee that you develop your role play, and even initiating, that will be scored how you initiate, in particular if you have identified if you have met the patient previously or not, because that will also impact how you introduce yourself and how you start the conversation with the patient. So if you haven't met the patient previously, then you introduce yourself. If you have, let's suppose you're a GP and it says your patient, then you're going to welcome the patient, but you really don't need to introduce yourself. So all of these are they are elements that are important for you to analyze, because you will be scored on that. So the first thing here, where is the consultation taking place? I would love to hear your answers. Send them in. I really love it when you guys participate. So where is this consultation taking place? There we go. That's it. The accident and emergency, ER too, similar. Okay, lovely. And who is the nurse speaking with? So right now, this is a candidate card for the nurse. So you are talking to a 26-year-old diabetic woman. So who are you talking to? Or better, who is the nurse talking to? There we go. To the patient, who is a 26-year-old diabetic woman. Perfect. The next piece of information is, how old is the patient? Okay, we've already identified that previously. So 26, that was easy. Now, is the diagnosis established? So that's something for you to consider. So all of these, when you're preparing, these are questions that you are going to ask yourself and try to find the answers in your card. Once again, that's going to help you initiate the conversation and develop it. So when we think of this, let's go back and let's check again. Setting, accident and emergency department, right? You are talking to a 26-year-old diabetic woman who has a small cut on her big toe. She cleaned it herself and put on a band-aid. Plaster, right? But her toe is very red and swollen now. She came into accident and emergency as soon as the toe looked infected, and is very anxious as she has been reading about high rates of amputation. So she's really under a lot of stress, and we know that you're talking to this patient. Now, is the diagnosis established? According to the introduction, not yet, right? We really don't have. We know her health condition. We know also her injury, not really an injury, but we know her health issue. So the next thing, what emotions are in the scenario? We can definitely see this, right? She is anxious, and it says so on the card. So there's anxiety involved. And of course, the next, anything else you noticed. So when we say find out about the injury, what happened and when did it occur? So that's, you're going to ask the question. Reassure the patient that she did the right thing. Important for diabetics to seek medical help immediately if they injure themselves. So the patient did well. Then you're going, now, of course, all of this, there's an interaction. It's not only the nurse who will speak. That's an important detail. So for each task that you have, the patient will reply. Also, explain the likely treatment. So it's IV antibiotics as soon as possible. She will also need dressing for her toe for some time. She will have to protect her toe while walking, so until the toe is completely healed. And you will give her a protective boot to step when she is walking so that she can wear it. And then you're going to empathize with her about her concerns, that amputation may only be necessary if the cut does not heal. So, diabetic, there we go, small cut, very worried and distressed. Perfect. You guys are right on track. Okay, so where is the consultation? You guys got this. Who is the nurse speaking to? We have here the diabetic woman, the patient. How old is she? We got that too, 26. Now, the diagnosis. We know that there is a cut, the patient is diabetic, she has diabetes, and there's a cut on the toe. So there's a condition. And then anxiety, she's scared, fear of amputation, and she did the right thing. So that was the nurses reassuring the patient that she did the right thing. All of this, sometimes you may feel overwhelmed because according to the criteria, there's a lot that you have to include when you're doing the role play. So it's not simply ask questions. You have to ask the question. You have to show empathy. You have to reassure. You have to reinforce. Sometimes it can happen that on the patient card, there are questions and comments that are not included in the doctor or nurse card. And that is on purpose, in fact. It is to test your attentiveness. Are you listening to your patient? So there's a lot. That's why practice will help you. And of course, being aware of the structure and how to tackle it. So the verbs are going to be your guide, definitely. It's important that you understand the kind of verb, the function of the verb, in order for you to ask the right question and to have the right to follow up as the patient replies to you. So when we look at this card, looking at the task, what are the verbs that you see? So in the task part, what are the verbs? There we go. So the first one, you guys got it. So it's to find out. So when you see find out, are you going to make a statement or are you going to ask a question? So the find out, there we go. Excellent. That's the make a question. You're going to reassure the patient, and then you're going to explain the treatment. So when you explain the treatment, that means you're providing information. Once again, for OET, not only do you explain, but you check with the patient, you verify. Is it clear? Do you understand? So on. Do you have any questions? So it's not only explain, you have the follow-up, which is to verify if the patient has understood what you have explained. And then in the empathize, it's mostly a statement. So each verb, you will have a different procedure and a different structure. It can be interrogative when you have to ask the question. It can be a statement. Intonation plays a very important role here. So find out, reassure, explain, and empathize. Great. Now, when you're going to reassure, it is a moment that you try to make the patient feel at ease. When you explain, in the explain part, you should definitely, even if you're explaining treatment and results, you should avoid very technical words and medical jargon. That will reduce your marks. So during preparation time, if you identify any of the, so for the IV antibiotics, that's okay. That is not a medical jargon. But names of diseases sometimes that are very complex. So be sure that you avoid technical medical jargon when you're speaking with the patient. So during preparation time, that's another job that you have to identify these keywords and find synonyms and possible paraphrasing for the technical words. Okay? So as you read the card, you have to focus carefully on the function verbs because this is going to guide you. Once again, some students or some test takers, you tend to rush and you even skip questions because you may think that you have to complete all of the tasks. But in fact, you don't need to complete all of the tasks in order to get a good score. Not completing all bullet points will not affect your score. They're scoring you on the interaction that you establish. So take your time, one question at a time. Be sure that you don't skip anything. And don't ask questions that are not really there because on the patient card, there aren't any answers for that. The patient does have on their card comments and questions that are not on your script. But once again, that is on purpose. So be sure that you keep track and follow as you go, because for each question or for each comment, be sure that you give time for the patient to comment as well. Because in the cards, they are connected. So here in this case, the task is to reassure the patient that she did the right thing. And it's important for diabetic patients, to seek medical help immediately if they injure themselves. So there are many verbs that we use to reassure a patient. Can you think of any verbs? Of course, there is the standard, I'd like to reassure you. But there are other ways to reassure the patient that she did the right thing without using the verb reassure. How could we do that? Because whenever possible, you should try to vary the vocabulary from the card. You certainly did the right thing. That's very good. You can definitely use that. You came to the right place. Excellent. That one is good too. Okay, you guys are right on track. That's it. So now we're going to listen to a sample answer and then we'll comment on it. Here we go.
Okay, Jane, you've done the right thing coming here to see me today. You've cleaned the wound, you've checked the wound, and you can see that it's obviously become a little bit aggressive. So as a diabetic of many years, you'll know that looking for medical advice as soon as possible is the right thing to do, and well done for doing that. Now, let's have a proper look and see what we can see.
Now, did the nurse use the verb reassure? Were you able to identify if the nurse used the verb reassure? Not really, right? That's it. You've done the right thing coming here. That's it. It's important for diabetic patients. Perfect. You guys are right on track. So once again, either finding a paraphrase or a synonym or simply restructuring the sentence. You can, do sentence inversion. or simply with your voice, with the intonation and the word stress, you can reassure. You don't necessarily have to use the verb reassure. Perfect. Okay. The next one, here we go. So this is the text. We're going to read and listen at the same time. And then I have a couple of questions for you guys. So here we go. So, okay, Jane, you've done the right thing, right? That's the first thing. Oh, hold on. Something is not working here. But don't worry. Here we go. So, okay, Jane, you've done the right thing coming here to see me today. So, this is a way of reassuring. You don't need necessarily the verb. You've cleaned the wound. So then the nurse is restating what happened to show for the patient to really feel confident. You've checked the wound, and you can see that it's obviously become a little bit aggressive. So as a diabetic of many years, you will know that looking for medical advice as soon as possible is the right thing to do. Okay, so all of these, the sentences in blue, show the reassurance so that the patient feels confident that you came to the right place to get help. Okay. Now, do you see in this answer moments of like little hesitations? There you go. There are, right? Um, so this is okay when you're answering, when you're speaking. You don't have to sound, you know, 100%. You do in natural speech. We have these little moments, and be careful because if you try to really have a memorized answer, you may even sound robotic. So be very careful with templates and memorized answers because they can sound robotic, and that really doesn't sound good on test day. Okay. So even if you have to take a quick pause to organize, don't worry because in your real practice, I'm sure that usually you do that. What is really dangerous in terms of like scoring is when you pause because you lack vocabulary or you don't know how to ask the question, you don't know how to structure the question, then it's an issue. If you have those long pauses of not knowing how to conduct because of language. So that would be, let's suppose, the danger. And of course, empathize with her about her concerns. Amputation may only be necessary if the cut does not heal. So when you empathize, that's when you show that you understand the patient. We just have to be worried. We just have to be careful not to use the wrong empathy because there are some key words. In this case, if I say, "Oh, I understand your concerns," that would be okay. Very well. I understand how frustrated you are. In fact, the patient really didn't show frustration but anxiety. So we have to be careful how to select the correct way of empathizing. Okay. And be careful not to be so I totally get you. So that you should avoid this kind using common language and everyday language, yes, but avoid very informal language. Not because it's rude, simply because it's not appropriate when it comes to OET answers. Okay, there you go. So let's listen to the empathy now.
I think it's quite understandable for anyone who is with diabetes to have these kind of concerns. And yes, of course, there are extreme cases where it may be possible or it may be required that amputation is needed, but it's a very extreme solution to the problem. And we will only go down that path if there's any question of the wound not healing. It's very much early cases.
Okay, so the concern, because the patient is really concerned of having to amputate because The patient has been reading and has expressed that to the nurse. So there we go. So once again, your answers and your usually your questions and your explanations and the interaction, it is in this area of 20 to 25 seconds usually, but that you don't have to be concerned about. It shows here the seconds, but that's not really, it's just for you to understand, kind of like, the volume is low. Oh, sorry. I'll try to adjust it for the next recording. Okay. So here we go. So just be sure that when you are replying to the patient, you consider, because even though you may be speaking to an interlocutor that is young, but the patient that you're speaking to, it may be a 77-year-old patient. So once again, you have to adjust to that. Of course, you're usually when you see a patient of 77, the way you may refer or explain or repeat or double check is slightly different. So you really have to treat the role play as if it were a real uh, interaction. I know that it's quite difficult because it's not very, it isn't very, let's suppose, how can I say this, natural. Okay? It doesn't look natural, it doesn't sound natural. But they expect that you adjust according to the patient description that you get on the card. If you're dealing with a child, or if you're dealing with the mother of the child, and so on. So moving on. So here is where it shows it's quite understandable. And then we will only go down that path. So you can see this is a collocation, it's informal, but it's not the informal of, like I said, oh, I totally get you. Okay. That would be really informal and what we call not appropriate language for the context of patient in a healthcare facility. Okay, now the scoring. So you'll be scored in two areas, the linguistic and the clinic. So the linguistic, here we go. The total is 24 points, and each of the two role plays is given a score out of four linguistic criteria. You will get a score of 6 out of 4. Okay, so intelligibility, can you be understood? Do you say the vowel sounds clearly, the consonant sounds? Because OET is a foreign language test, so it doesn't mean that you have to be a native speaker. No. So even if you have a mother tongue influence, that's fine. The thing is the sounds. So you need to pronounce little details. So for example, if you take the verb prefer, so prefer is 2 syllables, you're going to stress the second syllable. If you say prefer instead of prefer, that would be a pronunciation error. So the intelligibility, can we understand you speaking? Even if you have a mother tongue influence, that will not reduce your marks, okay? Fluency. So the fluency, it includes the pace that you speak at, of course, and it also includes speaking at a natural pace, not too fast, not too slow, okay? In the criteria list, one of the components, it says that you speak and you pause in between sentences. Because why should you do that? To give time if the patient has a comment, okay, or a question. Appropriateness. This is what we were talking about earlier when I said, oh, yeah, I totally get you. So that is not appropriate. I understand, or it's understandable, okay? So appropriateness, you will also be scored. That's mainly about vocabulary too. So resources of grammar and expression. So differently from other tests like IELTS, TOEFL, let's suppose, where grammar is really core in the scoring, for OET, it is, of course, grammar will be taken into account. However, if the grammar mistake you make does not really interfere with communication, let's suppose, oh, when did it begin? It's not correct, of course. There is a little penalty there. But the communication will still carry on, the nurse or the doctor with the patient. Because when did you begin and when did you begin? So these are subtle mistakes, but that does not interfere with the communication. Okay, so that's how OET deals with grammar. Now, the clinical criteria, you will get a score of 15. So there is a score of 3 for each of the 5. So 3 times 5, 15. Okay, so every class we deal with one in particular, but the 5 are relationship building. So it is, do you reassure, do you empathize with the patient? Understanding and incorporating the patient's perspective. So once again, adjusting your vocabulary and your attitude and your actions according to the patient. If it's a child, the mother of a child, an elderly patient, and so on. Providing structure. Once again, you have to keep, the interaction organized, not skip, move on in order to try to finish all of the bullet points. That's not a good idea for scoring. And information gathering, how you ask your questions with open questions and closed questions. If you're not sure how to do that, stay not today, but we always deal with this in our classes. So how to ask an open question, when to use an open question, when to use a closed question, and also appropriate questions. So that too, we will look into that in one of our classes. And information giving. This, once again, it's when you're providing you're explaining treatment results. So this is when you have to be sure that you avoid the medical jargon. Now, a little bit more about the clinical. So information giving. Here we go. So at times you may need to explain negative results or negative, health issue. So you're going to engage with the patient. You can't be vague or technical. You use everyday language. So let's suppose you have a benign tumor. You're going to avoid saying this. You can say that you have a lump, that it's like with a lot of vessels, and that this lump can grow, and so on. So trying to use language that the patient understands and doesn't, the impact is not so strong on the patient. Express genuine empathy. So once again, patients are people, not numbers. Once again, it can sound a little bit, how can I say this, unnatural for you, but every time your patient expresses any kind of distress, stress, pain, it can be 2, 3 times throughout the role play. You will always have to show empathy. So each time you have to reply with empathy. Okay? It can sound redundant, but that's OET. So be attentive. There are alternatives to I understand, such as that's perfectly understandable. So it's a common reaction. It's normal. Your reaction is normal. So this is the similar to what to saying I understand. So it's nice to have options. And be honest, not blunt. So on the card, principally, they guide you this. So if you don't quit, so even the intonation at this point, you're going to die. So that's not something that is expected for you to say. You need to say the same thing, but in a way that does not impact. So, kind of like, I think we need to address your nicotine addiction and explore ways of helping you to give up cigarettes. So, this is what OET expects from you, that even if you have to talk about something negative, that you use vocabulary, intonation that the patient will accept to at least listen. Okay? There we go. Now, some general strategies. Here we go for speaking. But before that, once again, just to remind you guys, today is not today, today is Black Friday, but we are in Black Friday, weeks. So take note, Friday 22. I would love to see you guys join us at E2. There are many activities that you can do, live classes that not only for OET, but to help boost your scores. For example, grammar classes, pronunciation, uh, scanning, learning how to scan a text. So there are lots of other classes, plus all the OET classes, of course, speaking, reading, writing, listening. So check out, and I would love to see you as a student at E2. So the first strategy is treat the role play as if you were with a real patient. As I said, sometimes it can sound very unnatural. Do not memorize long answers. You will be penalized because you will sound robotic. Smile, make eye contact, and as you speak, right? Once again, these are some strategies to help you. We're going to look at others. The second one is before you start. Now, if you're taking the computer based, you do not have the choice of underlining keywords. This you can do if you're taking the paper based. Uh, Make notes. Remember, I mentioned even if you're not going to really use your notes, but just the fact of taking your notes and organizing, it's going to help flow with the role play. So, this you can, but you don't necessarily have to. You can ask the interlocutor to clarify anything during the role play card, during preparation time. Don't feel that it will affect your scores, not at all. It can be meaning, pronunciation, vocabulary, context. You cannot ask any questions after the role play has started. Okay? So during those 3 minutes, it will not affect your marks. You don't really need to ask the interlocutor, oh, how should I address you, and things like that. You can either use the name, because you will always see the name on the screen, or you can simply make up a name, Mrs. Jones, and that's it, or Mr. Jones. The interlocutor will play along. You're going to read the role play card carefully. And if you're not sure that it's 100% clear the information, ask. The interlocutor will surely reply. Your ability to communicate effectively with patients in English is being assessed, not your medical knowledge. Well, what does that mean? So let's suppose the patient asks you, oh, how long does it take for paracetamol to be effective? At, I don't know, maybe at that moment you don't know, 20 minutes, 30 minutes, for it really doesn't matter what you answer because that's not being evaluated. Okay? And pay attention to the type of information you need and adjust accordingly. So, do you have to show empathy? Do you have to show understanding? What do you have to express based on what the patient, says to you? And then, while speaking, use varied vocabulary appropriate to the needs of the patient and the context. So, once again, if you're dealing with an elderly, a child, and so an anxious mother, so you can communicate in a variety of ways, meaning that you adjust according to what the patient replies. Speak clearly. Be sure that you don't mumble and you don't, mesh words. And be confident. You're practicing and you're preparing for your test, so you're going to be ready. Pronounce words clearly and correctly, and vary your intonation. A speaker without intonation in the real world, the listener will not engage. Truly, whenever I'm listening to someone who is speaking at that flat tone, I just give up because I don't feel involved. So, intonation, practice, do exercises for intonation so that you sound uh, attractive in the sense of the listener will engage with with what you're saying, and establish a relationship with the patient before you ask for relevant information, meaning introductions and greetings. Okay? And now, finally, you do not have to complete all the tasks. Definitely. Bear that in mind, please. And it's true. Make choices. Consider who you are speaking and how that affects your language choices. So, once again, the card and the information. Balance speaking and listening. Be sure that you give time to the patient to speak. And respond to what the patient says. Once again, even if the patient says or includes a question or a comment that is not on your script, don't neglect. If the patient asks for medication just out of, oh, doctor, don't you think, or nurse, don't you think that medication could be helpful? Well, we can look into medication, but before that, I'd like to ask you a few more questions, or we'll wait for the results. So don't neglect, okay? Well, thank you so much for joining me. I hope the class was helpful. So we covered today how to reassure and empathize with patients. Also, we covered to pay attention and analyze carefully the verbs when you're preparing for your role play. And finally, we had some tips. Remember, you don't have to complete all the bullet points. The most important is the relationship that you establish, asking questions and replying and interacting. Okay? Um, so, the pharmacist, each profession has a different card, but the criteria is the same for all. So, all of this about reassurance, empathy, and so on, it's for all careers, all professions in the medical field. Okay? The questions are going to be slightly different for sure, but the criteria list, the components are the same. So, thank you so much for joining me. Have a lovely week, and I'll see you guys again next week. Take care now. Bye bye.